Good afternoon, and thank you for joining me. Let me first say Dr. Levine is taking a well-deserved day off today. She has been working tirelessly, and so I suggested that she take the day off, and she's exhausted. And I really want to thank her for everything that she's done throughout this crisis. So I'm going to be providing you with the update on the 2019 coronavirus. But before I do that, I'd like to just say I drove up here today for the first time in 2 weeks. I left my house in York County, drove my Jeep, and was really impressed with what I saw. We Pennsylvanians are really doing a phenomenal job. Parking lots were empty. The roads were there were very few cars. And I think what we're all doing together is really phenomenal. So I just want to say thank you to Pennsylvanians. Thank you for staying in. Thank you for doing what it's going to take to defeat this virus. Thank you for giving us the time we need to make sure our healthcare system has the capacity it needs. So let me get back to the report. As we reported in our noontime report, nearly 700 new cases of COVID-19 were reported in Pennsylvania in the past day. So this virus is now in 59 of our 67 counties, and the number of new cases continues to grow each day. So today I'm going to be adding Carbon County, Cumberland County, Dauphin County, and Schuylkill counties to my stay-at-home order. And I'm going to be continuing to assess further additions to the list of counties based on where and how new cases are occurring. So as a reminder, if you are living in one of the 26 counties under my stay-at-home order, you should only leave your house if it is absolutely necessary. Because the number of cases continues to grow, I will be pushing back the end of the stay-at-home order to April 30th, and this is in line with what the President is doing at the national level. This is for all 26 counties, including the 4 new counties that I mentioned today, and added to the 22 counties that were up until today already under the order. And our business and school closures will no longer have a set date to resume normal operations. Up until now, I've been saying another 2 weeks, another 2 weeks. Now I'm going to leave the date indefinite. We're going to keep our schools and businesses closed as long as we need to keep them closed to keep Pennsylvania safe. Right now, it isn't safe. And I know this isn't easy to hear. We humans are built to want to work, to learn, to socialize. And it's hard being confined, as I know, to one place. We miss being with our friends. We miss being with family members. But if we want to save lives, we must continue to distance ourselves from each other. We're starting to get into warmer weather, and absolutely spring fever is going to set in. And that's going to make it even more difficult for us to choose to stay home. But stay home we must. So spend time in your yard or go for a neighborhood walk while maintaining a 6-foot distance from others. As I've said, this virus is really sneaky. And someone can be carrying it for 2 weeks without showing any symptoms whatsoever. You don't know who has it. You don't know if you have it. So we must all act as if we do have it. We must self-isolate. We must eliminate the further spread of this disease by staying home. We are supporting Pennsylvanians who are working to heal the sick, to heal us when we get sick. And we're making it easier for our supply chain to get all the things we need. So each of us, we must do our part. We've done a great job so far. Let's keep doing that good job, and let's keep at it, Pennsylvania. So thank you very much. Now I'd like to introduce Dr. Watkins, who's going to give an update. Dr. Watkins.
Good afternoon, and thank you for joining us for the latest update on the 2019 novel coronavirus, or COVID-19. As of 12 a.m. this morning, we have 693 new cases of COVID-19, bringing our statewide total to 4,087 Pennsylvanians who have tested positive in 59 counties. 33,777 patients have tested negative to date. Approximately 4% of our total cases are in healthcare workers, and less than 1% of our total cases are in the nursing home population. As yesterday, the Department of Corrections announced its first case in an inmate at a correctional facility. More than 386 Pennsylvanians have required hospitalization since March 6, when we confirmed our first cases. This is about 10% of people who have tested positive. Approximately 110 of the total hospitalized have required intensive care unit treatment, and about 67 of those have required the use of ventilators. A correction to our earlier press release, we have had 48 deaths among those who have tested positive for COVID-19. And I'd like to reemphasize Dr. Levine's daily reminders. Please wash your hands with soap and water for at least 20 seconds, or use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbows, not your hands. Clean surfaces frequently. That's counters, remotes, cell phones, doorknobs, all of the things that you touch. Practice these everyday prevention measures can really help slow the spread of this virus. If you have questions about your health, contact your health care provider. And if you need mental health resources because you or someone you know is experiencing a mental health crisis, contact the crisis text line by texting PA to 741-741. For the most reliable information related to this response, visit our website at health.pa.gov. And please stay home, stay calm, stay safe. I'll now turn it over to Governor to April for questions.
Yeah, to April for questions.
Thank you, Governor. From ABC 27, a state senator is suggesting you should rescind your order that all non-life sustaining businesses close, saying he'd like to see you require those businesses to follow CDC guidelines and leave it up to them to make sure their employees are being safe. What's your reaction to that proposal?
Yeah, we're trying to make sure that Pennsylvanians are safe, and employers and employees alike. And so to the extent that we can keep people from congregating, from coming together in businesses, anywhere, we're actually bending the curve, and we're buying time so that we can get to the point where our healthcare system can accommodate the demand for services. What we don't want is what happened, say, in Italy, where the death rate is over 10% at this point, actually over 11%. We need to make sure that that doesn't happen to us. What happened there was just simply an overwhelming situation where the healthcare system was not able, didn't have the capacity to deal and address the issues that they were facing. We do not want to get to that point in Pennsylvania, and so we do a hard stop. We do the mitigation required to make sure that we have that hard stop right now, and we don't get to that in order not to get to the point that Italy got to. So we really have to be as hard and as pure as we can here in terms of keeping our distance.
Governor, some questions about interstate travel. We are seeing PennDOT information, this is from the Times News, information boards with a warning for travelers from New York to quarantine for 14 days. Is that referring to the CDC's travel advisory, and has Pennsylvania placed its own restrictions on travelers from New York?
Yeah, we haven't had to because the CDC, the federal government, has absolutely said that is a federal guideline. If you're coming to Pennsylvania from New York, and that was just reconfirmed earlier this morning by the Vice President, you need to quarantine yourself for 14 days. So that isn't coming from Pennsylvania. It's coming from the federal government. It is in place, and that's why the signs say what they say.
From PBS 38, Governor, over the weekend you said that the state had not seen spread in PA as a result of New Yorkers fleeing the dire situation there. Since then, St. Luke's Health Network has declared the Poconos a hot zone for COVID-19 because of its proximity to New York. The Lehigh Valley Health Network says that patients are relocating out of high-risk areas like New York and New Jersey and Connecticut. Has something changed? Are PA health officials now seeing infected people coming here from places with a higher concentration of patients? And can anything be done about that?
Yeah, I think I said that there were some people who were coming from New York. I didn't know how many. I just still don't know exactly how many. I think there was some concern expressed in Philadelphia that the OBGYN departments were seeing new demand from folks from New York City who didn't want to deliver their babies in New York City. In following up on that, it seems like there's a bigger surge of that kind of thing in Wayne County at the I'm not in a position to say exactly how many people are coming from New York, but I understand there are people coming to New York. They are using our healthcare system, and that to the extent it causes an overload, that will be a problem. At this point, we have not heard of any hospital in the state that has seen that as an overwhelming, unmanageable challenge.
Governor, from the morning call, we've been told that East Stroudsburg University is under consideration by PEMA as a possible temporary hospital site, in part because of its dorms have kitchenette-fitted suites. Can you speak to the potential use of the state university facilities as temporary hospitals?
Yeah, if a hospital thinks that they can be useful, then we're very willing to do that. I think Bloomsbury actually was the first one to use, and Geisinger has expressed interest in using dormitories for, not so much for a hospital, but for dormitory for healthcare workers. So we're willing and ready to do whatever the state needs to do to help support the healthcare industry.
Dr. Watkins, the next question is for you. From the Scranton Times, not long ago we had concerns about an epidemic of vaping among young people. Does vaping increase the risk of developing more severe COVID-19 complications? And what would the message be for those who continue to vape now?
So we do know that vaping is related to lung injury, and lung injury is one of the risk factors for more severe presentation in COVID-19. So our message would be to reduce your vaping or to stop vaping.
And from WJAC, we've noticed that last week the daily increases in positive cases were jumping up more than 30% or higher each day. But those increases have been in the 20% range in the last 3 days. Is that a sign that we're edging towards a peak, or is it too soon to say?
So we're looking at case counts and rate of increase and change both across the Commonwealth and regionally and within counties. And so although we are seeing some positive indicators, it's too soon to say.
As a follow-up to that, Capitol Wire would like to know what a plateau of new cases would look like in terms of the numbers that are being reported.
So I would prefer that we're looking at this not just statewide, but it would be regionally. So we would want to see certain things happen over a period of time, not just in a few days.
And does that, from WESA as a follow-up, are there parts of the states where the curve might be bending, especially in areas that have enacted social distancing measures relatively earlier compared to the rest of the state?
And as I said, we are seeing some positive indicators, but it's a little too soon to say.
Okay. Governor, the next question is for you. From WPSU, some school districts are offering remote learning, but others aren't. What, if any, concerns do you have about the impact of the shortened school year on K through 12 education, especially for the most at-need children? How do you see the state addressing this?
Yeah, we are working on a plan to make sure that we have a way to provide an education for the kids who are not getting the education for the next 2 months. So we are looking at that. I think the hope is that we have that in place in the next few days, so that by the time we get to the end of the week, by the time we start next week, we will have an alternative to the brick and mortar schools that are there now.
And from the PLS reporter, in what ways would a federal disaster declaration for Pennsylvania help bolster the state's response to the COVID-19 outbreak?
It would just give us a little more latitude and more flexibility and some more dollars from the federal government. I think the federal disaster declaration actually gives us some monetary support that we don't have without it. So it would be a help. I've applied for it. I've gotten a confirmation that the application has been received, and we'll know in another day or two as to whether we actually get it.
From News Talk 104.1, Maryland just issued a statewide stay-home order. How close is Pennsylvania to doing that same type of order, even with the additional counties added today?
Yeah, the way we've done it in Pennsylvania is to try to take a measured and balanced approach and say, okay, we are rolling this out in those counties where the county leadership have asked for it, or in generally both are the case. They've asked for it, and there's a real need that there's an increase in the number of people getting sick, or an increased concern that more and more people are going to get sick. So we keep watching that. I think the way Pennsylvania is doing it is the appropriate way, and we'll keep looking at it. But again, if it gets to the point, we now have the disease has reared its ugly head in the overwhelming majority of the counties in Pennsylvania. If that continues, then we always have the option of moving to a statewide stay-at-home order.
From Bucks County News, as part of the Pennsylvania economic recovery post-COVID-19, what are your plans to lessen the impact felt by all Pennsylvania residents and businesses, as we currently have the highest unemployment claims and it continues to rise? How will we as a state recover?
Well, that's a great question. Every state in the whole nation is grappling with that right now. But a lot of what we will need to do is make sure that we provide businesses with the liquidity they need to stay to get back into business. That the workers that were laid off or furloughed are still in the area and can get back to work. We are looking at that, and we'll have a plan in the next couple of weeks. We understand that this isn't going to happen with a snap of a finger, that we're going to have a reasonable and detailed plan to provide the support the businesses are going to need to get back on their feet as quickly as possible.
We have several questions from reporters throughout the state about temporary hospitals, about using different facilities, for instance, the farm show, overflow potential in the Scranton-Wilkes-Barre area, and any other temporary hospitals in the Harrisburg area. Do you have plans right now for building temporary hospitals, and would you use the National Guard to do that?
There are actually two temporary hospitals that have come in from the federal government in the Philadelphia area. And that's a model. As the need arises in other places, that could be one option. Another is for the state to do what it can to keep existing health providers in business, as we've done with Easton. And it means making sure that dormitories, other public buildings are available for use in maybe after intensive care of patients. But we're open to any number of things. We're even looking at hotels as a sort of place that people can go after they get to be self-isolated for the 14 days. So we're open to providing whatever support we can, either in conjunction with the federal government or on our own, and in helping these healthcare providers do what they need to do to keep us safe.
From the Inquirer, Dr. Levine has said that the state is examining partnerships with manufacturers to make more medical equipment or PPE. Can you provide some more information about what the state is hoping such partnerships could provide, and how soon the state might have any agreements with manufacturers?
Yeah, the state is actually working in conjunction with the federal government, which is really trying to coordinate this across the country so that every state doesn't feel it has to go on this sort of wild scramble to get equipment, personal protective equipment, ventilators, beds, gowns, things like that. So we're doing a combination of things, working with state businesses to see if we can get them to repurpose for manufacturing some of these items. As you know, I had a kickoff with Fanatics to do masks and hospital gowns. They make Major League Baseball uniforms in Easton, and I think there's some things that we can do there. People are making masks in their homes, but we also are relying on the federal government to work with companies like General Motors. I had a meeting online yesterday with Philips Electronics. They have a place in Pittsburgh, and they are ramping up their production as quickly as they can. And so we're working on this on our own. We're also working with the federal government to make sure that we get to where we need to be as quickly as possible.
Dr. Watkins, the next question is for you. From Penn Live, I've heard coronavirus patients are typically separated from family at the hospital. I've heard that creates a potential for someone to put on a ventilator even if it goes against their end-of-life wishes, which they could no longer express. Is a situation of families not being present and coronavirus patients being unable to speak creating potential for some people to be kept alive on ventilators against their will?
I would say we've not been made aware of that situation. Theoretically, I'm sure that could happen, but I know healthcare is working tirelessly to really address family and patient situations, and we do stay involved in those discussions.
And then from the Citizen's Voice, I'm working on a story about the coronavirus numbers, and we saw Luzerne County had a pretty big increase today, more than 50 cases. Luzerne County now appears to rank 9th in the state as far as the number of cases. We were just wondering if there's any particular reason for a sharp rise, more testing, or is that just what you expect from the growth of the disease?
Yeah, I can't answer that one specifically for Luzerne. I mean, we are concerned about regionally the increase in that region now.
And then from WFMZ, some of the information that media were initially given about COVID-19 no longer seems to be valid. For example, it wasn't just the elderly who are seriously ill. Some form of VAS may be valuable even for healthy people. Can you tell us what we know now that's different as the disease has progressed across the country?
So we still believe, and the data supports, that the elderly are most at risk for severe complications and death from this disease. We are seeing the bulk of our cases in adults, not just elderly, but we do have some in young adults and pediatric population. Comorbidities do increase the risk of severity and death, whether that's in an elderly person or in our adults or children. But I would say it's still the elderly or adults who are at most at risk of severe complications and death.
Governor, the next question is for you. From Penn Live, there has been inconsistency detected in life-sustaining business waivers that have resulted in a business of one type being granted a waiver and another of the same type being denied. Is the administration doing anything to address these inconsistencies? Does the administration recognize that these inconsistencies are happening?
Yes. I mean, they're human beings making these decisions, so sometimes they get it wrong. Sometimes in inconsistencies, we uncover them and try to rectify them. Sometimes the inconsistencies actually are perceived, not real, and that there are areas that actually are life-sustaining that the business provides, that the category that they find themselves in may not. So we're doing what we can to make sure that those waivers are being handed out in a consistent fashion. But I think it's also true that we have, from time to time, made mistakes.
From WHYY, other states have imposed things like fines for people who don't follow stay-at-home orders. At what point would you consider taking such a measure? Are there any enforcement measures being taken beyond those for businesses that don't listen to the closure orders?
As far as I know, we haven't done anything beyond a warning, and the citations so far have been zero. It's because when we, state police, local law enforcement, tell a business that you really shouldn't be open, we haven't had a business push back yet. So the goal here is that Pennsylvanians understand how important this is, and then they're not doing what they do. They don't close down because it's the law. They close down because it's the right thing to do, and overwhelmingly that's what's happening in Pennsylvania.
Governor, from the Inquirer, as you've noted, we're up against a clock trying to buy time to help prevent hospitals from becoming overwhelmed. How much time do you believe the state has before that point? Is there a deadline that you're thinking of? Or is, along the imperative to increase stores and supplies of larger bed capacity in order to avoid hospitals becoming overwhelmed?
It's a moving target. That's the problem. Right now, the hospital system is not overwhelmed. There are certain models out there that are now very optimistic that say that Pennsylvania will not be overwhelmed. There are other models that say if certain trends continue, we will be overwhelmed. So it depends on the assumptions that you make. What it comes down to is that as Pennsylvanians make day-to-day decisions on staying at home, distancing themselves, washing their hands, doing the things that Dr. Levine, Dr. Watkins just talked about a minute ago, to the extent we do those things, we're not going to overwhelm the healthcare system. To the extent we relax, to the extent that we ignore those things, we are going to overwhelm the healthcare system, and the death rate is going to be much higher than it would be otherwise.
Governor, we have several questions about masks from WNEP and the Beaver County Times. Over the weekend, Senator Toomey joined calls for everyone to wear some kind of mask or facial cover when out in public. State guidance so far has been that you don't need a mask if you're not sick. Has that changed?
No, and I haven't spoken with Senator Toomey about that. I think the jury is out exactly what these masks do. If you buy a mask at the hardware store and use that, my understanding is it can actually reduce the extent to which you spread the disease if you have it. It's not clear that it actually prevents you from getting it from somebody else if you don't have it, that wearing a mask does it. So I think the jury is out, and I will continue to look at that to see what medical science tells us is the right thing to do there.
Governor, from PA Post, Dr. Levine mentioned yesterday that DCED has purchased ventilators. How many, at what cost, from where and what company, and when will they be available to hospitals?
We have a supply of ventilators, but we have, for the most part, been passing on the ventilators that we have when hospitals have asked for them. So at this point, we've been able to keep up with the demand. We still have a stockpile. That I don't know what it is as of today. It changes every day depending on what goes out. But so far, we've been able to keep up. I think if in a perfect world, looking at a very conservative model, if we could get another 1,000 to 1,400 ventilators in Pennsylvania, that would be great. So we're trying to do that.
And then, Governor, from Penn Capital Star, what tools does the state have at its disposal to either provide laptops or expand broadband access to students in those parts of the state that lack access to one or both?
We have a much greater ability to provide laptops than we do broadband, and that's why I proposed my Restore Pennsylvania program over a year ago, to try to get us to a point where we would have the investable funds we needed to actually extend our broadband coverage. Right now, Pennsylvania does not have adequate broadband in a lot of Pennsylvania, and that's just wrong. So we need to do something about that, and I have a plan, and I'll keep trying to convince the General Assembly of the virtues of that plan.
And then from the PLS reporter, Governor, what levels of PPE do the state corrections facilities have on hand? Has DOH assessed the potential impact of transferring inmates with serious COVID problems, symptoms to hospitals, and what impact that will overall have on the healthcare system?
Yeah, we've modeled that, but so far we haven't had a problem. We have one staff person at SCI Phoenix where we've had a test positive for COVID-19, but beyond that we have not had a problem. We've gone to a lockdown situation so that as of, I think a week ago, we have stopped visitors from coming to the prisons. We are taking steps to make sure that when prisoners go to eat, they do so in stages, not all at once. So we're trying to reduce the extent to which prisoners are in situations where this disease can be passed on to others. And we'll continue to look for ways to do that. In the meantime, I think the question was there are inventories of ventilators and hospital supplies in each of the prisons. And we think there's enough, but again, time will tell.
And then our last question, Governor, from Politico. Do Pennsylvania state officials feel the standards that determine how much equipment the state receives from the federal government is clear and fair?
Well, I mean, it's changing. I think the federal government has been doing as good a job as it could to catch up from the bad place it started out. And I think if you ask any governor around the country, they'll say the same thing, that federal government's doing its best. It started from a place that was not all that great, and I think is catching up. We've seen Abbott Laboratories now has developed a new testing method that we hope will work out, that can turn tests around fairly quickly. Johnson & Johnson is looking at a vaccine. The federal government has actually gotten companies like General Motors to step up to repurpose some of their assembly lines or their manufacturing to make ventilators. So, you know, we might have started a little bit late here, but I think the hope is we can catch up. And to the extent that happens, I think the federal government is doing what they need to do. Again, I think, as they say, they are playing a supportive role to what is going on in each of the states, and that's the way I'm looking at the federal government. They're backing us up.
Thank you, Governor. That concludes our briefing for today. For any reporters' questions we weren't able to get to, the Department of Health and the Governor's press offices will follow up with you. Our next briefing will be tomorrow. Thank you.
Thanks.